Hi, my name is Bethany Dugan, and I am a physical therapy student. And today I'm going to be talking to you about multiple sclerosis, also known as MS. You're probably here because you or a loved one have been recently diagnosed with MS, and like many of us, we still often leave appointments with so many questions. And so today, my goal is to provide you with some background information on what MS is, how it affects the body, and what physical therapy can do to help you. To begin, let's talk a little bit about our nervous system. So, the nervous system is broken down into two parts, the peripheral and the central nervous systems. And the central nervous system is made up of our brain and our spinal cord, and the peripheral nervous system is made up of all the other nerves within our body. And so, when we're speaking about MS, this is a condition that is affecting our central nervous system. The nervous system is made up of thousands of neurons, and so I'm going to go into a little bit detail about what a neuron is. So we have a cell body of our neuron that has many connections to other neurons, and then we have an axon, which is where all of the information is being sent out to other neurons and to other parts of the body. And so when we think about the axon, we think of its myelin coating, which is very similar to the coating around an electrical wire. And so individuals with MS, this myelin sheath becomes inflamed and is degraded, but the axon still remains. However, because of this loss of the myelin, the neurons can no longer talk between each other as quickly as they need to, so it decreases that speed of transmission. Now that we know a little bit more about what MS is, now I'm going to go into the different types. So the first type that we have is relapse remitting, and with this type of MS, you'll have periods of symptoms that will last a few days, months, but then we'll go back down to baseline or very close to baseline before a next flare-up. And the second type is primary progressive, and unfortunately, with this type, as we see in the graph, there is no remission of symptoms. And the third type is secondary progressive, and the first type that we talked about, relapse remitting, can turn into secondary progressive, where you do have those periods of relapsing and remitting, but it is progressing. In the fourth type, we have progressive relapsing, and with this type, it's not as common, but it is progressing, but there is a chance that you will have periods of relapsing of symptoms. The diagnosis of MS is given when there is 2 or more of those lesions found on imaging, and also symptoms are taken into consideration. Some of the first symptoms that most patients report are changes with their vision. They begin to have numbness, tingling, and weakness, and also loss of coordination and tremors can occur as well. Now that a foundation has been laid on what MS is and how it affects our body, I can go into a little bit of detail on what physical therapy can do for you. So you're probably wondering, will physical therapy help me during a flare-up? Is that even something that I can do during that time? And the answer to both of those is yes. Physical therapy, in conjunction with medications and other treatments, has been shown to improve strength, maintain strength and function so that you can be independent during those times. And physical therapy can also give you some techniques to help minimize fatigue and its effects, and to help you pace your activities throughout the day. So a lot of education that you can take home with you and things that you can implement into your daily life. Having a great relationship with your physical therapist is very important. Having an open communication about fatigue levels, what kind of activities you do throughout the day is very important, as fatigue is one of the most common complaints and can exacerbate symptoms even more. So it's important that you have that connection, that you feel like you can relay this information to your therapist, and so that they can tailor the treatment to what you need in that day, in that moment, to help you be independent as best that you can and to help you continue to live your life. And so, if physical therapy is something that you think would benefit you, I encourage you to talk to your doctor and tell them the benefits of PT and how you feel that it would help. Thank you for watching.